Hi, my name is Jessica Ignani, and I'm presenting today on cognitive learning theory and motor learning theory. So my objectives for this presentation is that hopefully after I speak, you'll have a better understanding of cognitive learning theory, a better understanding of motor learning theory, and also be able to use this content later down the road in your future teaching endeavors. So cognitive learning theory, according to our Bastable textbook, says that cognitive theorist perspective, in order to learn, individuals change as a result of the way they perceive, process, interpret, and organize information based on what is already known. The reorganization of information leads to new insights and understandings. So basically, the basis of cognitive learning content is we're trying to figure out what is going on inside the learner. So the learner bases most of their learning content off of their perception, their thought, their memory, and the ways of processing information through this cognitive learning theory. With cognitive learning theory, reward is not necessary, and mainly that the thing that drives the learners is their goals and expectations for themselves. Aspects that influence cognitive learning include past experiences, individual perceptions, aspirations, expectations, goals, social influences, and metacognition, which is the understanding of how you as a learner learn best. As we all know from nursing school, Gestalt is a theorist from the early 1900s who formed his theory off of human development, social constructivism, and social cognition. Emotions have recently been added to Gestalt's theory and believe that people respond to the whole situation versus just its parts. Gestalt's perspective on cognitive theory is one of the oldest psychological theories, which emphasizes the importance of perception in learning from a cognitive perspective with a focus on the configuration or organization of the pattern of stimuli rather than the discrete stimuli. It reflects the whole is greater than the sum of its parts. Cognitive development is a perspective influenced by Gestalt that pertains to qualitative changes in perceiving, thinking, and reasoning as an individual grows based on their external events and personal mentation. Psychological organization. Each person, in order to learn, has to organize their processing. They perceive, interpret, and respond to the situation or the learning environment in their own way. Sometimes things that influence this organization is the simplicity of the context, the equilibrium of the context, and the regularity. We need to take into consideration when teaching a new patient, for instance, with type 2 diabetes, the simplicity versus complexity. If the information we're relaying to the patient is super complex, it's going to go over their head, they're going to become overwhelmed, and they're not going to retain the information. So another example of simplicity would be using simple terms, not medical terms, that we all have a tendency of using since it's our everyday practice. With cognitive learning theory, the perception of the individual learning is selective. Selectivity is influenced by the learner's past experiences, their needs, their personal motives, attitudes, reference groups, and structure. For instance, when listening to this lecture, when you heard the word Gestalt, you probably kind of thought back to your basic information that you retained from him in your undergrad program. That is your basis of information. Therefore, when I talk about Gestalt, any of the information that you already know pertaining to him, you may ignore, which is understandable and I'm okay with, because you've already learned that information. So with learning also comes the memory. There's different stages of the memory process. One is the attention given to the subject being presented. Our senses are visual, auditory, and motor. Some students learn best by visually seeing a document or visually seeing a PowerPoint presentation, where others tend to do better by sitting and listening auditory to a lecture. Motor, which I will talk about later on, is skills that are acted out through motion and use practice to help facilitate the learning. Information that's transformed into short-term memory. Once you perceive the information that's being given to the learner, the information is then stored into memory. When that happens, either the learner will discard the information and not retain it, or they will store it into their long-term memory. And then finally, the action and response to the learning. Once the learning is complete and once the student has either retained that information in the long-term memory, they will then use it to their benefit or use it into their practice. Robert Gagnon came up with 9 events of the cognitive learning process. 1 was to gain the learner's attention. 2 was to inform the learner of the objectives and expectations. 3 was recall of the learner's prior learning, so taking into consideration past experiences or past lectures that they've had on the content, their present information that we're presenting to you. And 5, provide guidance to facilitate understanding. That's what the teacher is there for. 6, have the learner demonstrate the skill and information. Give feedback to the student. 8, assess the learner's performance. And 9, work to enhance retention via application and practice. Tennant was another theorist that took into consideration, similarly to Sternberg, that the educator needs to take into consideration the learner's preferences. Tennant proposed the information processing perspective that helps facilitate a learner's preference for obtaining and remembering and recalling the information is learned once the student is aware of their preferences. So 1, we as the educator need to have the learner indicate how they believe they learn best. 2, as they are learning, ask them to describe what they are thinking. And 3, evaluate for mistakes. And 4, give attention to inability to remember or demonstrate what is being taught. So the information that they're not retaining and the information that is very important, we need to then go back and give extra attention to make sure that that information is retained by the student. Another theorist that we all know and love from nursing school is Jean Piaget. Is a cognitive development theorist who worked with children to identify 4 stages of cognitive development: sensory motor, perioperative, concrete operations, and formal operations. According to Piaget's theory of cognitive learning, children take in information as they interact with people and the environment. They either make their experiences fit with that they already know or change their perceptions and interpretation in keeping with new information. Cognitive development is sequential, and some adults may never obtain the formal operations stage. It has also been proposed that adult learning can go beyond the formal operations because they may show an advanced level of reasoning related to their life experiences. So this is also very important to take into consideration when working with cognitive learning theory and working with our students, because depending on their age and depending on their cognitive development level determines how well the information is going to be obtained and retained and used later on. One of the big major criticisms that the cognitive learning theory comes across is that social influences have been left out. These include ethnicity, gender, family life, social class, and history. These can influence how an individual learns, and it should be taken into consideration. Emotions can also affect cognitive learning, and this is another area that the cognitive learning theory has had some backlash on, saying that it's left out. Empathy and moral helps to motivate students with their behavioral and ethical responses. Morale and decision making are affected by cognitive and emotional brain processing, for example, stressful situations. Sometimes certain stressful situations we excel with that learning situation. Other students don't excel in those stressful situations, so we also need to take that into consideration. Emotional intelligence is using motivation of self-reading, reading in interpersonal groups, reading emotions of others, and what made me think of this is Sheldon Cooper from the Big Bang Theory. he's a very smart, intellectual guy, and he retains his information great. But when looking at individuals, he has a very hard time with reading their emotional state, and sometimes bypasses that and will just pour out more information. That information is not going to be retained if they're in a poor emotional state. So we need to take those and take into consideration. So don't be Sheldon Cooper and look into other people's emotions as well. Another aspect that can affect cognitive learning theory is the living and social environment, their surroundings, and their backgrounds. One of the other things that is suggested by the Bastable textbook is that adults are self-directed and problem-oriented. So in regards to Piaget's cognitive development stages, we should take that into consideration for adults versus with the children. So learning is an active, cumulative, constructive process that is goal-oriented and dependent on the learner's mental activities. The faculty should emphasize on developing students in how they think. It is not transfer of information that results in learning, but rather the students must discover meaning by using the information, processing strategies and memories, and attentional and motivational mechanisms to organize and understand it. And this was from the Billings textbook. Now I'm going to talk a little bit about the motor learning theory. Motor learning it was defined by the Bastable textbook as a set of processes associated with practice or experiences leading to relatively permanent changes in the capacity for movement. Examples of motor learning would be motor skills in nursing school when you were in lab. Think of putting on and taking off sterile gloves, using a dummy to place a Foley or an NG tube. These are the skills that we practice in order to perfect. They're the step-by-step procedures and practicing that helps us to perfect these skills and keep it and learn it perfectly. So motor performance is different than motor learning. Motor performance is when a learner is able to teach back the skill being taught to them. However, the skill is not retained and the learner is not able to repeat the steps the next day. Sometimes I thought about this as when educating a patient who's newly diagnosed with type 1 or type 2 diabetes. When educating the patient, the first day it can be quite overwhelming. We'll give them the insulin injection, but we'll show them step by step. If we ask the next day for them to demonstrate it and show us or walk us or tell us how to do it step by step, they probably won't be able to just because they haven't had that repetition, they haven't had the practice, it's only been one day. So motor learning is confirmed when the learner is able to demonstrate the skill consistently over time and showing the learner that has retained the information. I find that I'm pushing it more and more on my unit that education for patients need to be started as soon as they're admitted or as soon as a diagnosis is brought upon so that we can have that repetition and give them the practice that they need each day with one of us available to help guide and walk them through it. I feel that information and the content and actual ability to give the insulin will be obtained and pertained and used correctly. It fits in Posner's suggested model for motor learning. The first stage is the cognitive stage. During this stage, instructors should emphasize the purpose, express similarities between other skills, minimize distraction, clear and concise instructions should be given to the learner. They should demonstrate ideal performance, so if you're inserting a Foley, it should be shown step by step how to do it precisely, sterile technique and all, before you're expected for the students to do it themselves. We should also break down the content into parts, encourage a teach back, and provide guidance for the student. It is expected for the learner to not be perfect, and they will make mistakes, and that is okay, and we need, as the educator, to let them know that this is acceptable. The second stage is the associative stage. This is how to do the skill and continue practice to perfect the skill. During this stage, educators need to provide the student with multiple opportunities for practice and repetition. As they improve with the skill, we should encourage increased distraction and complexity of skill, encourage problem solving, and avoid giving clues and hints. This is the next step. This is once they know the steps, but they need to perfect it. So we need to add extra obstacles to kind of help facilitate the actual life experience, like in the hospital. For instance, placing a Foley. A dummy doesn't move, so we need to add more complex things to kind of help maybe make the situation a little stressful, just so it kind of helps them problem solve a little bit more and get that expertise that we're hoping that they achieve. And the third and final stage is the autonomous stage, which is the performance of the skill is perfected with no guidance needed. This is, they're ready to go, they're ready to place a Foley, but demonstration of the skill always needs to be a part of the learning strategy, along with measurable goals for the students. Types of practice for motor: there is a massed practice, which is sequence of short test periods. So we're going to place a Foley. 10 minutes later, we're going to do it again. 10 minutes later, we're going to do it again. And we're just going to keep repeating it and keep repeating it and keep repeating it. The next type of practice is the distributed practice, which is spaced out practice time with equal amount of time and breaks. This I thought of would be our lab at Madonna University. Students would have to go once or twice a week, and they'd have to go for an hour at a time, and they would have to do these skills. They would also have free lab hours where students could go and practice, and then during the lab hours they would have to sign off. By having these spaced out times but having it available to them to take the breaks and to do the tasks and to do the practicing helps kind of give them an opportunity to be a little bit more independent, but also get that practice in. And the third type of practice would be variable practice. This is just random times or different types of environments. Examples, straight cathing in a bed versus straight cathing in a chair. It doesn't have to necessarily be, I'm going to actually place a Foley in a patient and in clinicals 1 week and then a month later do it again. It could be that the first time you place a Foley, the patient's lying flat in the bed and is compliant. The next time, variable, the patient is not compliant, is moving around, is a little bit more stressful for the student to do. So it's varying practices. That also counts for variable practice. Studies have found that aspects that challenge or make the motor learning more difficult benefits the learning and actually helps to facilitate the learning and actually make it more effective. So interference and guidance is good. However, if it's in excess, it can prevent the learner from solving their own problems, which would kind of hinder critical thinking skill development. So in order basically to retain the motor learning skills, the student has to practice. Discovery learning is a trial or error teaching strategy that allows the student independence and encourages them to solve issues as well. Mental practice is the act of visualizing yourself doing the task/skill without actually moving. This should be used in combination with the motor practice. Feedback is a must for the student and is intrinsic. The sensory and perceptual information that arises when movement is produced and can include both visual and sensory motor information, or can be extrinsic, which is meaning it comes from an outside source. So as a summary, your cognitive learning theory is a theory based on how an individual learns based on the way they perceive, process, interpret, and organize information. There's been multiple theorists who have developed techniques and developed additional aspects to this theory that kind of help to guide the educator when teaching students. And motor learning consists of skills practiced on using movement to achieve and perfect. And the biggest thing with the motor learning is the student has to practice. And I would now like to talk about my impression on cognitive learning theory and motor learning theory. I feel that individuals don't just learn from in one certain way. I feel that the topic that's being taught depends on what type of learning style is going to be most beneficial for that student. Each theory has their own time and their own place. So for me, nursing school, I just keep going back to nursing school, and one of the things that I relate most to is the clinical labs and the practice and the repetition. My cognitive learning was I had sheets that listed the step-by-step directions. It showed me what I had to do. It told me the exact reasoning. It told me the exact examples of why I would be doing this procedure for my patients, and it actually broke down the information I need to know cognitively in order to do the actual procedure as a nurse. Where in order to perfect the skill to actually implement what I had learned, I needed to do the motor learning too. I needed to have the practice. I needed to be confident. I needed to be able to walk into the patient's room and know that I was going to place this Foley, and it would be one time and I could do it, and I wouldn't have to worry and I wouldn't stress. But this stress and this example, I mean, it depends. It all depends on my past experiences. It depends on fears. It depends on what I've already known or what I did before. I was a patient care tech at a group home that had traumatic brain injury patients. So I had already done straight casts. So I felt confident in that. However, at the group home, it was not a sterile technique. It was a clean catch because they were in their normal environment. But I had a basis of knowledge which helped to facilitate kind of a courage or a confidence in myself. So then I wasn't afraid to do it. Where tasks like an NG tube, I will be honest, I inserted my second NG tube in my patient this week, and they still intimidate me, and I don't know why. I have my cognitive tools where I have it listed for me, step by step by step. I know why I need to put it in. I know how to put it in. I know the reasoning or what the implications for putting one in. And I've done the practice on a dummy. I've done the step-by-step. I've done the practicing in clinical lab, but I don't have as much experience with actually doing it to have the confidence as if I do for my Foley catheter. So overall, I just feel that depending on the situation and depending on what I'm trying to learn, depends on the type of learning style that's going to be best and most beneficial for me at that period of time. So cognitive learning theory is great. The motor learning theory is great. However, I'm not going to do practice on med-surg content. It's not going to be relevant. It's not going to be effective. Versus my cognitive learning style where I can say, okay, you know what, my dad has type 2 diabetes. He has to give himself insulin. I have a foundation of knowledge, and then I'm able to apply that and then learn it. And I'm also motivated to learn it because it also influences somebody I know and care for. So it'll be beneficial to do a cognitive learning style for the med-surg aspect of type 2 diabetes and the fundamentals. But when actually administering insulin, the cognitive learning theory isn't going to be helpful. It's the motor learning theory that's going to help me. For my references, I use the Bastable and Billings textbook. I hope that my presentation helps give you a better understanding of what the cognitive learning theory is and also what the motor learning theory is, and I hope you can use it later down the road when you're teaching your students. Thank you.